preparation phase begins when a person steps onto the bowling lane, grasps the ball of the ball return, and aligns the body to the target. During this phase, the head remains stationary using the deep neck flexors that are the stabilizer muscles of the neck. These include the longest capitis and the longest cola. The abdominal muscles of the core, especially the obliques, are also involved in stabilizing the upper body and core. The right hip joint of Rhett is slightly extended, and the right and left knee joints are flexed at an angle. The anterior serratus, hamstrings, upper and lower abdominals, quadriceps, gluteus maximus, and the calf all assist in this movement of preparation. As Ashley demonstrates, the right shoulder joint is in isometric elevation due to the ball's weight of depressing the joint. The right shoulder girdle is in slight isometric upward rotation. The trapezius and anterior and posterior deltoids help accomplish this motion by contracting. The right elbow joint and the right wrist are both using isometric flexion. This includes the humeral joint, the proximal and distal radial joint, and the radiocarpal and midcarpal joints. The humeral joint is using flexion, while the proximal and distal radial ulnar joints are using supination. The radiocarpal and midcarpal joints are in neutral flexion extension as well as ulnar deviation. The wrist is using flexion due to the weight of the ball. The muscles assisting in this part of the preparation are the biceps, forearm, and triceps. The left hand is used as a support. Unless the bowler is left-handed, then the role switches. Flexion of the wrist and fingers are accomplished by contracting the flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, and the flexor pollicis longus. The movement phase begins with the first step of the left foot and continues through to the release of the ball. The first step in the movement phase is a small shuffle or half step with the left foot to help get the bowler's momentum started. The left hip joint is brought into flexion, as Rhett shows, by contracting the iliopsoas complex, which includes the iliacus and the psoas major. The rectus femoris is also used. The right gluteus maximus and hamstrings contract to produce extension of the right hip joint. The right and left knee joint go into extension, which is caused by the contraction of the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The right ankle is now in plantar flexion, as Rhett shows. The prime movers of this action of the ankle are the gastrocnemius and the soleus. The second step is taken by the right foot. At the same time that Ashley takes this step, she also initiates the ball into the arm swing. This action is commonly referred to as the push-away. The right hip joint is flexed by contraction of the iliopsoas complex and the rectus femoris. Ashley's left hip joint goes into extension. The prime movers of this action include the gluteus maximus and the hamstrings. The right knee joint remains in extension, but the left knee joint goes into flexion now. The muscles Ashley uses for this action are the biceps femoris, semitendinosus, and semimembranosus. Usually, both the right and the left shoulder joints go into flexion with contraction of the anterior deltoid and the upper pectoralis major, but in this case, Ashley preferred not to use the left hand to support the ball in this step. Ashley's right shoulder girdle goes into abduction with contraction of the pectoralis minor and serratus anterior. The right elbow joint moves into extension. The prime movers of this action are the triceps brachialis and the coneus. The right and left wrists and phalanges are isometrically flexed by contracting the flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus, and the flexor pollicis longus. The third step is taken with the left foot. Simultaneously, the left arm moves off the ball completely, as the right arm starts to descend from the starting height. The swinging arm that holds the bowling ball represents a free swinging pendulum. The left arm, which is seen as the balance arm, should move horizontally to provide balance to the shoulders and the body. The right shoulder joint moves into extension as the bowler swings her arm back. This movement is created by the contraction of the teres major, latissimus dorsi, and the lower pectoralis major. The right and left shoulder girdles move into scapular adduction as the prime movers, middle trapezius and rhomboids, contract. The left shoulder joint is horizontally extended by the anterior deltoid and the upper pectoralis major. Both the right and left elbow joints, as Rhett shows, are extended. However, the right elbow joint is in complete extension as the bowler swings the ball backwards. The agonist muscles for elbow extension are the triceps brachii and the anconeus. The right wrist and finger joints remain in isometric flexion. The right and left knee joints are now in extension. The right hip joint also remains in extension, and the ankle joints remain in plantar flexion, as Rhett is illustrating. The fourth step is taken with the right foot. This is the moment right before Ashley releases the bowling ball. This step begins the power phase of the bowling movement. At the end of this step, the back arm swing of the right arm that's holding the bowling ball should have reached the highest peak, as Ashley shows. The only change in muscle contraction in this step involves the right hip joint. As the step is taken with the right leg, the hip joint goes from extension to flexion. The prime movers of this action are the iliopsoas complex and the rectus femoris. The fifth and final step that Ashley takes during the bowling movement is the delivery of the ball. The final step is taken with her left foot. As she takes this step, the right leg is used to push and exert extra force to push her into the slide. As the slide occurs, the bowler's hips slightly drop. Her arm swing is brought through, swinging the ball into a forward motion towards the pins. Ashley's left hip joint transitions into flexion. The agonist muscles that she uses are the iliopsoas complex and the rectus femoris. Her right hip joint is in extension due to contraction of the gluteus maximus and the hamstrings. Her left knee joint transitions from extension to flexion by the agonist muscles, the biceps femoris, semitendinosus, and semimembranosus. The right knee joint remains in extension from the previous phase. Ashley's right ankle joint is plantar flexed by contraction of the gastrocnemius and the soleus. The right shoulder joint transitions from extension to flexion. The prime movers of this action are the anterior deltoid and the upper pectoralis major. The right shoulder girdle transitions from adduction to abduction as the pectoralis minor and serratus anterior contract. Ashley's right elbow joint remains in full extension from the previous phase. The wrist and fingers remain in isometric flexion. Trunk lateral flexion also occurs due to the slide. The agonist muscles used for this movement are the erector spinae, external oblique, and the internal oblique. Contraction of the rectus abdominis, external oblique, and the internal oblique provides slight lumbar rotation. The follow-through phase begins as the thumb exits the ball. The arm swing continues its natural path of an upward and outward motion, lifting with the fingers as they come out of the ball finger holes. During this phase, the bowler continues the sliding motion due to its momentum, as the release of the ball occurs down the lane. All joints continue in the same plane of motion as the previous phase. However, the right shoulder girdle begins to move into some more upward rotation. The agonists of this action are the middle trapezius, lower trapezius, and serratus anterior. Whitney's right elbow joint is slightly flexed after the ball is released. Her right wrist and phalanges are now in a static position.